In the country as a whole, the infant mortality rate ranks 15th among nations. Is that correct?
Mm-hmm.
It's unacceptable for this country to rank 15th in infant mortality. We ought to be able to change that record. You are anxious to enter into a practice that is associated with improved outcomes, and yet you've been denied hospital privileges. Let me assure you that many of us see a great reason for supporting your profession because consumers ought to have the right to choose.
My struggle to obtain and keep hospital privileges is happening all over the country, and it seems ironic. For throughout many cultures and throughout many centuries, the traditional helpers of women giving birth around the world have been midwives. The wisdom and compassion of these traditional midwives was a source of strength and understanding for other women. Birth was seen as a natural part of family and community life. In the pioneer days of the United States, practically trained midwives continued to be the primary source of care and caring for birthing women. But with the emergence of organized medicine in medical schools, the physicians, most of whom were men, assumed control of the childbearing process. And hospitals, with the latest equipment and machines, soon became the fashion. The place physicians preferred, the only place believed safe. With pressure from organized medicine, the practice of midwifery was forcefully banned in many states, and birth appeared to lose its special place as a normal event. A few traditional midwives continued to serve in the rural and poor areas, carrying on a largely oral tradition, ignored by organized medicine and by the politicians. While midwives had delivered 98% of the babies born in the 1800s, in the name of medical progress, this figure was reversed. They attended the birth of only 2% by the 1980s. Today, in answer to the demands of women and their families to regain control over their own health care, the practice of midwifery is growing again, as we reassert our time-honored role as the advocates of normal birth.
The major issue today is not the place of birth. The major issue for nurse midwives today, as I see it, the one that overshadows all others, is will we help parents to regain the control that is rightfully theirs? For in so doing, we will realize the great privilege of being a nurse midwife.
I'm a Sister of St. Mary, and it's a Franciscan order, and we are basically all healthcare providers.
That's your baby? Yeah. Oh, he's so big.
And I got into midwifery basically because I loved OB nursing as a young nurse, and I didn't want to end up a supervisor.
Good baby, gosh, she's so loving.
I wanted to actually be with mothers and do things with them.
Tell me. Yeah, she remembers.
And I came here because it really looked like a golden opportunity to really practice and do it for people who had no other means of care. This county is one of 4 counties that make up the Rio Grande Valley. The area has a very high poverty and a very high Mexican-American population. The poverty level, as of last hearing, was 58%. I've gone to homes where all the children were having for supper was fried potatoes because that's all they had was potatoes. My whole mind was set on how can I best help these people, and by and large, their greatest need was a delivery service. They just really didn't have a place to go that they sincerely could afford. I like the concept of a birth center attached to a freestanding clinic. Su clínica familiar, your family clinic, that everybody from a carried unborn baby to the oldest person in the community can all be seen under the same roof. We're going home, right? Okay. Now, we'll be home to see you at your house on Thursday. Okay. That kind of comprehensive health care, not sickness care, but health care, and that maternity is looked upon as a normal process. And also to provide them with some type of care that was geared for them, that touched all the wonderful things they have in their culture. Now, one of the things that I've noticed in my years being here is that many of you won't eat lemons when you're pregnant. And some people say if you eat sour things and your baby's going to be sour and it's just, you know, not going to have a good disposition and all that. But you can eat lemons, it's okay. And eat corn tortillas, don't eat flour tortillas. People love flour tortillas. I love flour tortillas, so I know you love flour tortillas. I think we have developed a concept at the clinic of people realizing that there are people there who really care about them. Not just say so, but really do. And I think that that really touches something. How old are you?
17.
And how many children do you have?
1.
1. How old's that baby now?
He's 10 months old.
Oh my goodness, 10 months old. You had one just this year then, huh?
Yeah.
Okay, we'll get this little thing out here and try to figure out when you're due. Su Clínica has been shown to have excellent statistics. Now, did anybody in any side of the family have diabetes?
No.
How about TB? One of the most obvious ones is that the prematurity rate we have is half of that of the state of Texas. And obviously we're getting good babies.
Boy, she is so strong. Look at her head. She has such good head control.
Yes,
You become kind of a wise person in the society. You know, it's very fulfilling to realize that you play a very vital part to the community.
Try to get them real quiet, if you can. Yes.
She will still have the same reflexes that she had as a baby, as an infant. When you put this, she should grab your finger and not flare out as she will when she gets older. See, she can almost pick up with her toes just like she can with her hands. I have believed from the day I came here that home visits were a very important part of what I must do to get you out in the community. No, people know who you are. You ride around. You have a feeling for where the people you serve are coming from. You sit down for a few minutes and talk a little bit. And gee, your baby looks nice today. Know that there's somebody there and what you need and all that.
Yeah, you know who Mama is, don't you? Just look at her, you sweet thing. Let me just take a quick little look at you and see how you're doing here.
And when I went to get my chickens, I knew exactly where to go get chickens. You know, I mean, I didn't have to look around and think or anything. I knew exactly who to ask and how I could get chickens. I mean, it sounds silly, but those are the kinds of things that you can touch. My needs are fulfilled as well as others are fulfilled. And so midwives find themselves often the defenders of the natural. I sometimes feel like people have just now caught up to what I was doing, you know. I believe that I hold the dubious distinction of being like the grandmother alternative birth centers in this era. I think the concept of alternative birth centers is growing. It's rapidly growing is just a better term to say.
Oh, Mimi, for goodness sakes, I was so jealous.
Now you see middle-class women, upper-class women saying, I want a choice too. I want another way to have my baby. And they are very involved in the beginnings of birthing centers. They're in Florida, New Mexico, Denver, Oregon. And like in Pennsylvania, they have all the alternatives in a service. You can have it in a lovely birthing center, which they have fixed up. You can have the baby at home, or you can have the baby in the hospital. But for me personally, short of the Holy Father telling me I had to do it, I really don't think I will ever go back to the hospital again. I just believe when things are perfectly all right, when women are okay, it's a healthy kind of activity that happens to people and should be done in a healthy environment. And what are we doing in alternative birth centers? We're letting people be in charge of themselves. We all believe that the best medicine for everyone is the human touch. There's somehow people caring about you, and that's probably why our medication level is so low. We really stay with our mothers.
Oh, that's the secret. That is the secret to having an easy baby. It's relaxing. Because a baby wants to get out, and the harder you fight, the harder it is to get out.
I think that it is absolutely pathetic that we fail to realize how many problems we cause by intervening. I believe that when you start putting emphasis on useless things, then the important things get missed.
Everything's good, baby sounds good, water's clear, everything's just real nice.
I think no matter how many years I'm in this profession, and no matter how many hours I put in or how tired I am, there's still nothing I love better than labor and delivery. That I really, really do love to sit there and just somehow, it's just awe-inspiring to watch nature do its job and to just be supportive, to really respect it and see it work.
If you feel like it's really pushing down, you let me know. Is it doing it?
Yeah, it seems like it's opening.
Bend her knees so that her foot sits right here on this knee.
And she was just an absolute pleasure in labor.
Excellent. Here it comes. It's coming, Virginia. Good. Real slow, Virginia. Real slow. Gentle, gentle, gentle. Gentle, gentle. 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 There we go. Just a little more. Little more. There. There, you sweet thing. Gently, gently. There, you sweet thing. And the tremendous amount of energy or renewal one feels after a birth has taken place. The exhilaration that's present, no matter what the circumstances are, it's always there because new life came to be and you saw it and it was just marvelous, Yeah. Oh, so pretty, baby.
Yes.
You can open your eyes.
It looks like cream all over.
It is, and it's so nice. Let me put it on face. See how nice that is? Isn't that nice? Put it here by your eyes. You don't get any wrinkles. That's what they say.
Hey, keep some.
And we're, the rest of us are wonderful viewers and disciples of how wonderful it is that nature works as well as it does.
There, you gonna look at us? Looky there. Looky there. Oh, sweet baby girl. There you go.
What brought me to Aspen was skiing. I work in a private practice with an obstetrician. I really feel that it's the ideal place to be. People are very concerned about their health, and I really love it here. When I'm skiing, the beeper that I usually carry that would call me if a patient was in labor doesn't reach that far over the mountains and hills. So in order to be available, the ski patrol is called, and they place my name on the boards that you see as you go up on the ski lifts. When I first came to town, people didn't know what a nurse midwife was. People will say, oh, you do deliveries in the home. And I say, no, I don't. Some nurse midwives do. I do them in the birthing room at the hospital. People think that a nurse midwife is somebody that only delivers babies. And there's so much more that a nurse midwife does as far as prenatal care, following people all through their pregnancy, delivering them, taking care of them after they deliver, seeing the mother, sometimes seeing the baby, and doing family planning.
The way that it works is that after I insert it into the uterus, it sits there, just like that. And after 3 years, then these have to be changed. And so we'll just remove this one and put in another one, unless you've decided by then to have your third child.
When I first came to Aspen, I had the choice of working for one of two obstetricians, and I unfortunately chose the one that held different philosophical views than I did, and it didn't work out. And when I transferred to another practice, 2/3 of the obstetrical patients began to transfer their care to my new office, which was really a joyful triumph for me. It turned out that I was actually the person that was giving them the emotional support that they needed in their pregnancy, as well as the education.
Linda's just so good about that. She really listens to your questions and she really answers them. Linda gives you some credit for having a mind, and it just seemed to me a whole lot more logical to go to a woman than to a man. She's so much more empathetic and so much more understanding about what's going on with your body. And she seemed to go along with a lot of the ideas that I had about what I wanted for my birth. So after that first visit,
Here, Jean, and let's sit down and talk a little bit about...
She's really good about taking a lot of time to answer questions about the birth and about pregnancy.
The results of your cervical check today just shows that your cervix is thinned out to about 60%.
Aspen Valley Hospital is just a tiny 52-bed hospital set amongst the mountains here of Aspen. It's not a restrictive type of atmosphere. They're very open, receptive, and whatever seems safe and the couple wants, that's what the people go along with. When I first arrived here, I introduced the concept of the birthing room. It's a very flexible, warm atmosphere. It's home-like as any hospital setting can be.
How long have you been here?
A good hour and a half.
Yeah. No.
Yeah. Oh, you're doing very well. And it does go fast.
Yeah.
You're working hard.
I don't feel like it.
Good. You will later. Jim was really supportive, and that was really nice. And
Really strong.
Linda,
Yeah.
I can't say enough. I mean, she was just really good. And it was nice to, you know, be able to just kind of visit and joke around a little bit. And
She had a very long, slow labor. She progressed, but very slowly. And we really worked as a team, and Jean was very prepared for the labor. She really handled it exceptionally well. And she got a lot of support, she got a lot of back rubbing, and she really liked effleurage, you know, massaging of the abdomen. And so we all took turns, and we all relieved one another, and we all played midwife, really, to Jean, you know. And it took all day and into the evening.
towards the end, Linda was very supportive, very encouraging, and said, we're going to get this baby out.
So we'll just let you decide now what you want to do, okay? But I think
First of all, can we come up a little bit?
Sure. Anytime you want to push, you can push.
Okay, then what we're going to do is take a look.
And then the doctor that came in, I thought for sure he would just say, okay, take her in the operating room, you know. And he said, no, I think you're going to do it. We'll push some more.
How much of a push?
Just a little one.
I can see his face. Oh, he's right there. Oh, baby. Oh, is it a girl? Yeah. Oh, baby, I don't believe that you're here.
Terrifically. Nobody could have done better.
I don't know about that.
Well, I do.
It would have been simple to have a cesarean. I mean, it's just amazing. And they didn't have little teeny fingernails and everything.
Hi, Sarah.
Sure, it's amazing.
Hi.
I think she's pretty neat.
Yeah, well, you sure took your time, didn't you? That was no easy thing, was it?
Oh, well, through it all.
I'm Marion McCartney, and I have a group practice with 2 other nurse midwives in Bethesda, Maryland. We formed our corporation in order to provide services to people who wanted to have their babies at home. And like all nurse midwives, we work in collaboration with physicians when complications develop. And over the past year, we have been attending hospital births also. We are now fighting very hard to keep these hospital privileges. But every time nurse midwives around the country now are getting into the private sector, it's a case of having to prove yourself, that you're safe, that you're reasonable, that you're well-informed, that you know what you're doing. And the biggest thing is that the clients are demanding nurse midwifery services. I mean, the nurse midwives are there, and of course we want to work, but we wouldn't have jobs if it weren't for the consumer demand for a different kind of healthcare service.
Hi, Carol.
Hi, Nancy. How are you?
Okay, how are you doing?
Just fine.
Going into maternity center is like old home week. You go in and you get your own chart, you take care of your own weight and urinalysis. It's just such a total sense of being responsible for yourself. I think women in general are looking for more and more self-reliance. They want to be responsible for their own bodies. They want to be responsible for their own birth. In many cases, you'll hear of a woman who will be going to a physician who will say, "Don't worry about it, honey, I'll take care of everything." Women are not wanting that anymore. They want to take care of it themselves. From the reading that we've done, birth is natural about 95% of the time. Only 5% of births need medical intervention. And we wanted to have it at home with our family around us.
Because that's a perfectly legitimate place to have your baby, at home. All across the world, people have their babies at home. The whole human race was born at home until about 50 years ago. And it's okay to do that if you use some sensible, common sense guidelines and you have a good transport system to the hospital in case you're having a problem. And you're looking for things to go wrong. You're standing there and you're watching and you're observing. But that doesn't mean you're in there controlling the whole thing and saying you must lie here, you must put your hand here, your foot here. If we do that to animals, they stop labor. If we made a cat deliver in stirrups, she wouldn't deliver, you know? But we do that to women all the time, and we think of nothing of telling a woman who's this much head is showing on the perineum to stop pushing, get into this bed, ride down the hall, get into this room, switch over to this bed, put your feet in these stirrups, still don't push, right? Put your feet in these stirrups, now you may deliver. That's bizarre. We screen our clients very carefully to make sure that the people that we're dealing with are generally very low risk. Carol had her last baby at home and was convinced that that was the only way to go and wanted to have this baby at home also.
Let's talk a little about when you're going to call in labor.
Yeah.
I would rather know early, you know. I would rather know if you think that you're going to labor. How long was your last labor?
The last labor was about 2.5 hours long.
I want to know really early that you're going into labor. You know, the first twinge, maybe today. And just call me and tell me that's what you're doing. And I would rather come out and make a false visit, and we'll all sit around and laugh and have a cup of coffee and then reconvene on another day.
In the Scandinavian countries and in Belgium and Holland, most of the obstetrical care is given out by the nurse-midwives.
It feels head first. It feels like the back's along here, the breech is up
with the obstetricians there for the high-risk, intensive care kind of labor and delivery that's prevalent in a very small percentage of the cases.
I know that's real sore. Hold on to that.
And they have excellent infant mortality rates, excellent maternal mortality rates and outcomes, and these are nurse midwives who are generally caring for the people.
A grand total of 38 centimeters. 38? Perfect. It's you. Let me see if I can hear the baby's heart along this side.
Very recently, women have become much more assertive and aggressive about what they want in the way of health care.
Sounds great. The kids want to listen?
Oh, so they've made a whole lot of changes. The changes for natural childbirth, for breastfeeding, for fathers participating in the delivery, for infant bonding and early discharge from the hospital did not come from the medical and nursing professions. It came from the consumer.
Your ear, Scott. It's real quiet now. It's real soft. It goes okay? I'm going to put it right there.
I hear nothing.
Listen again.
I think the baby burped.
And so what we're trying to do in the hospital is to create a system where the patient feels she has control. She has a right to say, I don't want this to happen, I don't want this to happen, within a reasonable limit. People don't go bananas with their demands. They're very reasonable kinds of people. And if someone's going to pick the baby up and carry it out of the room, where are you taking the baby? That's my baby. Where are you going with it? Even if the nurse is just going to weigh the baby across the hall. I mean, oftentimes that's all she's doing. But she has to learn how to turn around and say, I'm going to weigh your baby across the hall. And the baby weighs, da-da-da-da-da, you know, that kind of stuff. That's harder to change those kinds of attitudes than it is to change the walls. Everybody has a birthing room now, and they have wallpaper and curtains and wood furniture, but it's hard to change people's attitudes about how they treat women in labor. For a long time, I would go to deliveries and arrive at the door, and the parents of the woman in labor would be at the birth, and they would open the door and say, oh, I really was expecting someone totally different looking. I still get questions like, are you a nurse? Do you have a college education? Where did you become a midwife? Do you have anything to do with the medical profession?
Come on, Liz, do it!
Some people still don't understand that a nurse midwife is a registered nurse that's gone through a program approved by the American College of Nurse Midwives, and that she's passed national boards.
That's a girl, terrific!
It's such a big question now. There are a lot of women who are lay midwives that would like to come into the nurse midwifery field. The problem with the lay midwives now is that there isn't any general, nationwide, recognizable way to identify them. I think some of them are excellent. Some of them have loads of experience. Their hearts are in the right place. I think, however, that there are some lay midwives that are not any good, that have very minimal types of experience. And the public is really at a loss to identify who's who. Hi, this is Marion McCartney, 364. You bellboyed me? Yep. Carol Hombo? Okay, yeah, I got her number. Thank you. Bye-bye. I love it. I totally enjoy the work. Sometimes it's very hard, and the hours are terrible if you lose 2 or 3 nights sleep a week. But the work is so rewarding, and you get such positive feedback from the families. I think that families want to regain control over their own birth, and nurse midwives are willing to give them that control. And no matter if nurse midwives are practicing at home or in the hospital or in the birth centers, I think that we're going to be around for a long time to come. I love being a midwife.
Flow. Okay. Keep it up. Keep it up. Flow.
Right, now you can push with it, Carol. Again.
That's right.
Okay. Stop. Stop. Come here. You're done.
There you go.
That's it. There you go. I don't know.
Looking up at Mommy. Mom, quit naming Frank.
Presentation of this program has been made possible by a grant from the Mary Jane Company, manufacturers of maternity and nursing wear.